Hi, this portion is we're going to talk about squatting. So it's the very next page on your PDF file. I want to just talk about that squatting is one of the most common positions used to give birth in many cultures. And the benefits to squatting, right, helps actually get the body in a natural alignment, and it puts pressure on the uterus, so will help assist the baby in coming out. When you squat, it also helps shorten the birth canal. When you lean over, it's going to shorten this distance, and versus being more upright, obviously, or lying on your back, it's going to make this distance longer for the baby to come out. This really can shorten second stage, so while you're pushing the baby out, usually takes 2 hours for a first-time mother. And so if you're using the squatting position, a lot of times that can speed up that portion of the pushing. The most important benefit to squatting, and knowing that it opens the outlet of the pelvis by more than 10%. So you can see what happens is the baby's head has to come through here, and the outlet of the pelvis is here. So it increases this region by more than 10%. So it's going to give more room for the baby to pass through. How a coach can help mom remember to squat is she's simply, if she's ever going to go pick something up off the floor, a lot of times she can actually injure her back if she's leaning over from this point. She needs to squat to pick stuff down and then bring it up. So coach, remind her anytime you see her picking something up off the floor, you want to remind her that she needs to squat. If you want to use this birth position in labor, you've got to practice. If you want to try to squat even a few times, you'll probably already notice that your legs are getting tired and getting sore. So if you plan to use this position in birth, you really have to prepare your body ahead of time. And what you want to do when you squat is you want to lean over, having your belly down, and then you're going to put your hands on the floor and then bring your tailbone down. All right, now you may not be able to get your heels on the floor. That's not really a big issue. As you continue to do this exercise, you should be able to get your heels on the floor. And then what you want to do is, as you come up, you're going to bring your tailbone up and then come all the way up there. A couple of other benefits that I do want to talk about and bring them up now, and that way you'll realize how important squatting can be for your birth process, is a lot of people don't know that when you're giving birth, you see the tailbone here, and this is something that Neil and I learned in our Bradley classes, is the tailbone actually flips back. So as the baby is passing through here, it can not only nudge against the tailbone, but actually push it back to come through. Women have bruised and even cracked their tailbone during a birth process. And this definitely could be the reason. A lot of women, of course, are lying on their back and they're having someone tell them to forcefully push. And a lot of women, because they're medicated, don't realize and can't feel exactly what's happening with their body to tell the doctor that it may be causing her some pain. So, and it's not giving enough room for the baby to come through. Now you'll see on a video that they even talk about when you're lying on your back that it makes the outlet of the pelvis smaller. So you really want to incorporate squatting in your birth plan, at least in the pushing part. Another reason why you really don't want to lie on your back to give birth is because of the perineum. And I want to bring up the perineum so you'll understand some of the terminology that we'll use. The perineum is the area between the vaginal hole and the rectum. So it's going to be this little distance right here. All right, now obviously if a woman is on her back, where's all the pressure going? All right, all the pressure is going to be coming out the vaginal hole, and it's going to be on the lower half of the hole against the perineum. This increases the likelihood that a woman will experience a tear or have to have an episiotomy. Now, obviously, when you're in a squatting position, you're going to even out all of the pressure on the vaginal canal, and you'll reduce the likelihood that you'll need an episiotomy or that you'll experience a tear.